Anatomical Principles of Endoscopic Sinus Surgery, a step-by-step approach by Renuka Bradoo. So today we are going to learn about the contents, that is embryology, osteology, the lateral wall of nose, endoscopic anatomy, radiological anatomy, anatomical variations and surgical anatomy. So first let's start with embryology. He who sees things grow from the beginning will have the finest view of them. Aristotle. Embryology. The development of the nose and paranasal sinuses needs to be studied in conjunction with the development of the face in order to have a complete understanding of the subject. Facial development takes place mainly between the 4th and 8th weeks of intrauterine life, during which time a mass of undifferentiated swelling at the head end of the fetus undergo growth and remodeling to form a distinctly recognizable human profile. The face develops from 5 facial swellings that surround the stomodium or primitive mouth by the end of the 4th week. The swellings consist of a central unpaired process called the frontonasal process, a pair of maxillary and a pair of mandibular processes. The maxillary and mandibular processes are both subdivisions of the first pharyngeal arch. The frontonasal process is the downward proliferation of the ectoderm over the forebrain. Here we can see the frontonasal process, the chest cavity, then we can see the lens placoid, then nasal placard, maxillary process and mandibular process. This is the 5th week of embryology and formation of facial processes. So here we have the frontonasal process, lateral process, nasal process, eyes, maxillary process, medial nasal process, naso-optic groove, mandibular process. That is the 6th week of embryo. Then 7th week of embryo, that is the medial migration of the maxillary process. We have the medial nasal process, lateral nasal process, nasal pit and stomodium. During the 5th week, a pair of ectodermal thickenings appear on the frontonasal process. These are called nasal placards. In the 6th week, the ectoderm in the center of each nasal placard invaginates to form an oval nasal pit. The raised rims of these nasal pits form the lateral and medial nasal processes. During the 6th and 7th weeks, the maxillary processes on either side increase in size and grow medially. This medial migration of the maxillary processes cause the medial nasal processes to move towards each other. As the maxillary processes grow medially, they fuse first with the lateral nasal process and then with the medial nasal process. This separates the nasal pits from the stomodium. The medial nasal processes fuse with each other to form the intermaxillary process. The central tissue of the intermaxillary process get pushed upwards to form the nasal prominence characteristic of human beings. The intermaxillary processes forms the central bridge of the nose and the central portion. This is the frontal nasal process becomes narrow. Then there is a developing cheek. Medial nasal processes fuse to form intermaxillary processes. Maxillary and mandibular process fuse to form cheek of the upper lip called the philtrum. At the end of the 6th week, the nasal pits deepen and coalesce to form a single cavity behind the intermaxillary process. This cavity is initially separated from the stomodium. Lying below it is by a thin membrane called the oronasal membrane. This membrane ruptures during the 7th week to form primitive choana, which is the opening of the primitive nasal cavity into the stomodium or the developing mouth. The intermaxillary process grows backwards to form the nasal septum. The lateral nasal processes enlarge to form the nasal alveoli. They grow backwards to form the lateral nasal wall. This developing lateral nasal wall, that is we can see the oronasal membrane, a 6-week embryo showing the primitive nasal cavity which is separated from the oral cavity by a oronasal membrane, and we can see the tongue. We can see the 7-week embryo breakdown of oronasal membrane. We can see the primitive choana and primary palate. Here we can see the choana, secondary palate and definitive choana. This is the 9th-week embryo, formation of secondary palate and definitive choana. Shows multiple antronasal anterior posterior elevations which are finally reduced to 3 or occasionally 4 in number. These are the turbinates which overhang corresponding meatai. The maxillary processes fuse with the lateral nasal processes. The junction of their fusion is marked by a groove called the nasolacrimal or naso-optic groove. By the 7th week, this groove invaginates into the underlying mesenchyme to form the nasolacrimal duct. The canalization of nasolacrimal duct continues throughout pregnancy and may not be complete till after birth. The floor of the nasal cavity, which is the hard palate, is formed during the 8th and 9th week. The medial surface of the maxillary processes forms thin medial extensions called the palatine shelves. These shelves first grow downwards on either side of the developing tongue, but by the end of the 9th week they rotate upwards into a horizontal position. They then fuse with each other in the midline and with the primary palate anteriorly to form the secondary palate. The secondary palate also fuses with the lower border of the developing nasal septum. The nasal cavity is thus divided into 2 nasal passages which open into the pharynx behind the secondary palate through openings called the definitive choana. The mandibular processes grow medially and fuse in the midline to form the lower lip and jaw. On 24th day, the buccopharyngeal membrane in the depths of the stomodium ruptures to form a broad, slit-like embryonic mouth. The mouth is reduced to its final width during 2nd month as fusion of the lateral process of the maxillary and mandibular processes creates the cheek. At birth, the volume of the cranial vault is 7 times the volume of the facial skull. This ratio steadily decreases during infancy and childhood. This is mainly as a result of the growth of 4 pairs of paranasal sinuses and the development of the teeth. Here we can see the nasal septum, tongue and the palatine shelf. This is the 8th week embryo, formation of palatine shelves. Here we can see the nasal septum, palatine shelf and tongue. That is the 9th week embryo, rotation of the palatine shelf. Formation of definitive nasal and oral cavity. That is we can see the nasal concave, fused palatine shelves and tongue. Structures contributing to formation of the face. Processes and structures formed. Processes: frontonasal process, forehead, bridge of nose, medial and lateral nasal prominences. Maxillary processes: cheeks, lateral portion of upper lip. Medial nasal processes: philtrum of upper lip, crest and tip of nose, septum. Lateral nasal processes: ala of nose, lateral nasal wall. Mandibular process: lower lip and jaw. We can see the diagram of frontonasal process, maxillary process and mandibular process. The sinuses develop from invaginations of the nasal cavity that extend into the surrounding bones. The maxillary and ethmoidal sinus develop in utero during the 3rd and 5th fetal months respectively. The maxillary sinus is in the form of an elongated sac in the neonate. With the eruption of the deciduous teeth, it enlarges to become 3 times longer anterior-posteriorly and 5 times greater in height and width. Thus, the floor of the maxillary sinus, which is above the floor of the nasal cavity at birth, lies below it in adults. The ethmoid sinuses are small before the age of 2 years, then grow rapidly till 6 to 8 years, but do not complete their growth until puberty. Around the 2nd year of life, the most anterior ethmoidal cells grow into the frontal bone to form the frontal sinuses. The frontal sinuses are visible on X-rays by the 7th year of life. Both the 2nd and 5th years, the most posterior ethmoid cells grow into the sphenoid bone to form sphenoid sinus. The frontal sinuses do not start developing until the 2nd postnatal year. Sphenoid sinuses do not usually develop until 5th year of life. Growth of the paranasal sinuses not only changes the shape and the size of the face in childhood but also adds resonance to the voice in adolescence. Thank you. We'll be learning about osteology in our next video. Thank you everyone for listening.